Welcome everyone. Today I gonna discuss about one of the important issue, especially healthcare system. How actually healthcare system work and why healthcare system is very important. Goal of this module. After the model, participants should be able to understand, describe the structure of US healthcare system because I'm discussing about US healthcare system, especially for some developing nations and how they can grow. Describe how the US system healthcare system is funded, discuss current and the future challenges to the structure and funding, find information regarding the healthcare system. Is this patient to me? Survival is a real world practice. You eat what you kill. Physicians need to understand the various payment and care system to be able to keep their practice solved. Ignoring the business of medicine can be fatal to medical practice. In these patients, to me, the ongoing on implementing problem, access, right, and justice, fairness, all have very different meanings to different people. For example, in access to the healthcare, a right, is it the given by the constitution? Is it a transnational human rights? Need to be comfortable, field a rational response. These concepts are beyond the scope of module, but these terms are used to describe aspects or deficiencies in our system. Is the pertinent to me? If you care about nothing else, federal and state government face a nasty bill. Ultimately, scarce tax revenue is allocated for a variety of costs. The tax revenue comes from us, the taxpayers. Quality of care. US residents receive around 50% of the care that is recommended. Is that good or acceptable? Individual expenditure by 2025, average family premium will equals medium's income. This means 50% of American will spend every dollar they make on a health insurance policy. National expenditure 16% of GNP in healthcare, 25% of economic growth between 2000 to 2005. Leading cause of premature death: genetic 30%, genetic 40%, behavioral patterns, shortfall in healthcare 10%, environment exposure 5%, social structure 15%. Actual cause of US death to 2008, leading cause of death. How do physicians address this cause? Do expand office hours to see all of the patients? Maybe thinking outside the one-to-one clinical encounter to is appropriate. Why or why not? The healthcare system, what it does. One perspective provides services: somatic, medical, dental, mental health, counseling, complementary or alternative. Another perspective: primary care, disease preventions and healthcare provision, vaccine administration, prenatal care, secondary care, disease detections, breast cancer, hypertension care, disease treatments, preventive measures, depressions. The healthcare system, five main components: education and research, professional school, support, drug, environment, insurance, government, media, Medicare, CHIP, commercial, self-insurance employers, Blue Cross, Blue Sides, payer state agencies, BC or BS commercial insurance self-pay provider. Preventive care, primary care providers. Sub-accurate care, intermediate care, ambulatory surgical centers. Beside that, in this system, they have accurate cares, auxiliary service, rehabilitation service, long-term cares, integrated care, complementary or alternative medicines, public health, environment healthcare, cancer, basic science, interdiscipline, pharmacology, these parties, physical fitness, nutrition, and biostatistics. Health conceptual framework, determinant of health, policies and intervention, behavior, individual biology, social and environmental, physical environment, and access to quality healthcare. Health conceptual framework, employee-based coverage, government, individuals, healthcare system, doctor, hospital, pharmacy, alternative, mental health, and everything. United States, uninsured 16%, others 1%, Medicare 12, medical 13, individual 5, employer 53%. Employee-based coverage, the most common type of health insurance providers in USA. Employer base and individual, 53% employer base, 5% individuals. Most of will have different plan in 2%. Average monthly premium, geographic variations. Employee-based and individual tax policy favor employee-based benefits. Average sections, people who know they are sick are more likely to buy health insurance. Make insurance difficult, lead individual purchase healthcare to be much more expensive. Medicare's 42 million recipients, federal funded, 65 years old if qualified, disabled or need or home dialysis, 13% federal budgets. ABCD, hospitals and skilled nursing cares, outpatient physical visits, C, medical advantage, D, drug plan. There are different kind of characteristics of the medical populations: low income, lack drug, chronic, fair and poor, cognitive mental enrollments, and so on. Historic and project number of medicine beneficiaries and number of workers per beneficiaries. Medical ports, 52 million recipient, federal state partnership, eligibility covers more clinical services. Medical port, my contractor medical HMO, future, prescriptions, drug limit, utilization review, peer review. Medication expenditures, the over 45 million in 2004, coverage equal to service, but cannot they just buy insurance? Characteristics of uninsured: is income, work status. Project government versus private dollar as a share of the total uncompensated care in 2004. Financial burden of medical bill by insurance status 2003. Per capita health spending. And summary: health itself is not simply a function of healthcare, but rather a complex interplay of genetics, behaviors, social circumstances, and environmental exposure. The structure and function of the US health care system is tremendously complicated, with a myriad of stakeholders advocating policies in their self-interest. Physicians must acknowledge our society need for them to leaders and agents for changes in the complicated system. Massachusetts healthcare platforms passed April 2006 aim to provide universal healthcare coverage, require all adults to purchase health insurance, low cost option for healthcare, Commonwealth choice, mass health, employers with 11 or more employees required to provide a group health plan. Looking up information of the healthcare system: backbone, gray literature, statistics, research, journal article, international healthcare resources. Background: resource that offer descriptive consumer levels, medicine plus healthcare health system topic, examination generic to consumers, topics such as how to find a doctor, medical or Medicare office sites, kaiseredu.org from the non-profit Kaiser Family Healthcare Policy Institution, tutorials coverage, emphasize on growing concept, also include topic like women health, long-term care, and child insurance. Boxes, good for explanations, books, integrated interdisciplinary factor of the healthcare system, electronics and print books, secretary Amazon, Google Books, and check the catalogs. If you does not own a book, try to Boston Library. Gray literature, a lot of material concerning healthcare issues. This type of information is often referred by as a gray literature because healthcare is currently such a prominent and conservative issues. Gray literature can also lead you to a lots of statistics. So there are a lot of informations we can utilize, like looking up statistics, like Agency for Healthcare Research and Qualities, Massachusetts Health and Human Service, Research Based, NCHS, and everything's departments, research based, mm, business source complex, congressional index, web of knowledge, uh, PubHub mental service. A series interacts to find PubMed citation. Use a search team of your own and narrow to one of the predefined area. Appreciation, process assessment, outcome assessment, cost, economy, qualitative research. People 2010s and international healthcare. Global health fact from the Kaiser Family Foundations include data and fact organization, health funding, WHO, World Health Organization, Popline, international database of perspectives. Uh, these are the different kind of resources we are utilizing. So this is the way actually we are discussing about healthcare systems from the first world, and this way we can grow and build up together. Thank you everyone for joining today's sessions. Thank you. If you have any kind of questions, you can ask me. Thank you.